informational webinar. That's what I was looking for. I wanted to make sure this was being recorded. Okay, awesome. So my name is Kate Kunzel. I am the Director of Admissions for the Physician Assistant Program at Case Western Reserve University here in Cleveland, Ohio. I'm joined today by Logan Jacqueline. She is with our enrollment team, and Adina Sasan, who is our admissions coordinator for the Physician Assistant Program. A bit later today, we will be joined by a couple of current students, and they will be logged on during the question and answer session at the end of the presentation, so that you'll be able to ask them any questions directly if you have student-specific questions about our program. So we'll go ahead and go through some slides and give you some information about our program and about applying to our program, and then there will be plenty of time at the end for a question and answer session. Okay, so again, we are the Case Western Reserve University Physician Assistant Program. We are located in Cleveland, Ohio. There are several graduate and professional students, many represented here at Case from 50 different states and 94 different countries. We are a private institution located in Cleveland, Ohio. In terms of the PA profession, there is pretty substantial job growth projected through 2029 from the Bureau of Labor Statistics. So about 31% job growth. There is a demand for physician assistants in our health system. We are the #2 best healthcare job. We are #3 in the best 100 jobs and #3 in the best STEM jobs. And that's according to the most recent US News and World Report rankings. In terms of salary, PAs make a pretty good salary. The median salary is around $120,000. Our graduates make anywhere between $100,000 and $160,000 upon graduation. And that depends on a lot of factors like what specialty they might be practicing in, where they're practicing geographically, and whether they're practicing at a large academic institution or in private practice. So a lot of different variables in terms of salary. These are some photos of our current students. We do have smaller classroom sessions. So in addition to students being in a lecture hall together, learning together, we do have smaller classroom sessions, which you can see in the top left photo. The bottom photo on the left, these are our recent graduates, the class of 2025. We are deeply rooted in community service in our program. So this is one of the community service activities they participated in. I'll talk about that a little bit more in a little bit. And on the photo on the right is our class of 2026. During PA week, they do different sort of themes for each day. And this day happened to be wear something from your favorite team. Photo on the left, our class of 2026. This was the day of their white coat ceremony. That happens at the beginning of the program for our students. And then again, the photo on the right is another photo of our students out doing service in the community. They do some oral health education for elementary school students. So that's a photo from one of those experiences. So we are a graduate level program. It's 102 credit hours in 27 months. This is a lot of credit hours. So if you yourself have completed another graduate program like a Master's in Public Health or a Master's in Business Administration, or you have friends who are in a master's program, this is very different. This is way more credits. I got my Master's in Business Administration a few years ago, and that was 39 credits. And this is 102. So it's a very different sort of beast than other graduate level programs. The 27 months run continuously. So students start our program in middle of May, and they run continuously for 27 months until they graduate 2 years later in August. There are breaks, there are semester breaks, there are holiday breaks, but for example, the students do not get summers off in our program. The first 15 months are the didactic phase of the program. So this is where students are in the classroom, in the anatomy lab, in the simulation center, learning the foundational knowledge that they can then build upon in their clinical practice. The second phase of the program is the clinical curriculum, and that's where students rotate through different clinical clerkships, again, continuing to learn, but also applying the knowledge they learned in the first year of the program to taking care of patients in the clinical year of the program. In order to progress from the clinical year, from the didactic year to the clinical year in our program, students have to have a minimum of a 3.0 on a 4.0 scale. Upon graduation from our program, students earn a Master of Science in Physician Assistant Studies from the School of Medicine. You may see that different programs have different titles for their degree that they award. As long as you graduate from an accredited physician assistant program, it doesn't necessarily matter what the title of your degree is. After graduation from our program, students have to take and pass the Physician Assistant National Certification Exam, which is the PANCE. These are our boards. So in order to practice as a certified physician assistant, a graduate has to pass this exam. We're very proud that we are the #1 PA program in Ohio, and we are number 58 across the country, according to US News and World Report, most recently in May of 25. So when you're looking at different PA programs, there are a lot of similarities among PA programs, but there are also a lot of differences. So you just kind of want to pay attention to what makes a program unique and try to learn more about or perhaps apply to programs that appeal to you in terms of their characteristics. So as I mentioned, we're deeply rooted in experiential learning and community service that is integrated into our curriculum. So students, as part of their weekly schedule, will go out and provide service to the community. And I'll talk more about those opportunities in a minute. We have an amazing clinical simulation lab, as well as a human cadaver lab. So in the simulation lab, our students are working with standardized patients. These are actors who are hired to portray the role of patients. And they get into the sim center and start working with standardized patients basically the first semester that they're with us, and that continues throughout the duration of our program. I have some photos of our sim center coming up. And students in our program do participate in an anatomy with human cadaver lab. It is in person, it's not virtual, it's in person. The students who are going to be logging on can probably attest to the amount of time that they spend in the cadaver lab and in anatomy in the first semester of the program, but it's an incredible experience. Interprofessional education just recently went through a transformation, which is why I don't have any details underneath that box. But basically, our students participate in 2 semesters of interprofessional education during the didactic year of the program, where they are learning with and from students from other health professions, including medical students, dental students, social work students, students from speech and language pathology, genetics counseling, and nursing. So it's really unique that we offer such a longitudinal interprofessional education curriculum for our students. Our students also participate in preclinical clerkships. They will, in their spring semester of the didactic year, they will go and spend half a day every other week in an outpatient clinic or office, working with a preceptor seeing patients. So it's sort of a preview to the clinical year. So our students get more experience interacting with patients, working with a preceptor, and doing a variety of things, maybe taking vitals, maybe taking a history from patients, maybe helping the preceptor with some minor procedures. Again, just hands-on experience. And then we do a lot of case-based learning and clinical correlations. As I mentioned, there are most of the time the students are all together in the classroom in a lecture hall, 40 students. But there are many opportunities where our students learn in smaller groups and learn in smaller groups with faculty members. These are some photos from our simulation center. So the photo on the left is from the birthing simulation. So that's our birthing simulator. Her name is Lucinda. She delivers the baby. The students deliver the placenta. Lucinda and the baby are hooked up to monitors. So we're able to simulate different experiences or different conditions as someone experiences delivering a baby or birth. So for example, the simulator can have variations in heart rate or variations in her breathing or her blood pressure or the baby's heart rate. And then our students have to respond to those changes. The photo on the right is using some augmented reality. Again, this is part of our birthing simulation experience that our students have. Also from the simulation center, you can see the mannequin on the left is an interactive mannequin. So we were able to hook up EKG leads to him. So again, we can manipulate that to create different scenarios for students to respond to. So if the patient all of a sudden goes into AFib with RVR and drops his blood pressure, our students are there and have to make clinical decisions to respond to those scenarios. Again, it's great to practice before they're in front of actual patients when that happens. And then we also do some point of care ultrasound. So that's Dr. Adler, one of our faculty, demonstrating some point of care ultrasound in the simulation center. We also have the ZILS Immersive Learning Suite. So this is a super cool aspect of the simulation center. The walls are actually interactive. So students can go in there and work through various scenarios and clinical cases, basically touching the walls and sort of interacting, working through cases that way. So just a very cool feature of our program. And again, as I mentioned, our students also learn in smaller groups. So this is case-based and problem-based learning where students, about 6 to 7 students and one faculty member get together every week and work through cases together. So it might start with like a 27-year-old female presents with a cough. And we start with a really broad differential of anywhere from, oh, she has an upper respiratory infection, a viral infection, to she has tuberculosis. Getting various data points and information about that patient to then narrow the differential diagnosis down. So that's a really fun activity and fun way to learn. Okay, so our clinical rotations, we have 12 one-month-long clinical rotations with our hospital partners that include the Cleveland Clinic, University Hospitals of Cleveland, the VA, and Metro Health Medical Center. Our program, our clinical year faculty find the rotations for the students, so it's not the student's responsibility to find their own rotations. There is an option to potentially do some out-of-state rotations. So if, for example, you can set up a rotation with a site where you did your your patient care experience before PA school. Our clinical team will work with that site to try to create an affiliation agreement for you to rotate at that site. And each student gets to select 2 elective rotations. Again, service to the community. This is the 3rd time I've mentioned it. It's really important to us. So we think this is really important to expose our students to barriers to health and healthcare, access to healthcare. It also gives them confidence in patient interactions. It gives them experience providing patient education. A lot of what we do in the community is providing education to people. We oftentimes do these community service activities with other health profession students, so it gives them another opportunity to practice on an interprofessional team, and it helps build compassion and empathy. The list on the right are some of the sites where our students do their community service. So you can see there's a couple of homeless shelters on the list. They also do health screenings at various sites, oftentimes at farmers markets. They will set up a table and do health screening like blood pressure, finger stick blood glucose, weight and height, and then do some education around that for the patients who come for those screenings. We do have some extracurricular opportunities. These are optional. The one is the student-run health clinic. It's a multidisciplinary clinic, and students from social work, medicine, nursing, and dental provide care to patients from the greater Cleveland community free of charge. A lot of these visits consist of visits for sexually transmitted infections, but it gives the students opportunities to get involved with various committees, so like media and development, outreach, and things like that. First year PA students are able to be junior clinicians at the clinic, so they will work with a senior clinician to get a pertinent history of the patients. And then students are able to be senior clinicians after their 3rd rotation of the clinical year is completed. The students say overall it's a super fun opportunity to meet students from other programs and learn about their professions, as well as practicing focused patient care for a population that is in need. We also have PA Salud. This was established by a couple of students in the class of 2024, along with one of our faculty members, Professor Placucci. And their goal is to increase awareness and education about health disparities and provide mentorships to students from underrepresented communities and participate in community outreach events, also to practice and review medical Spanish. They provide health screenings around Cleveland. They mostly do things like blood glucose levels, blood pressure, diabetic foot exams. There are always translators present, so even if a student does not speak Spanish, they are able to participate in the PA Salud events. They also do outreach to prospective students or to let people know about the PA profession in case that's something that they might be interested in pursuing. And again, they assist with bilingual education to people who want to learn more about things like strokes, heart attacks, and things like that. So great opportunity to engage with this community. If you have a background in medical Spanish, it gives you an opportunity to practice that. But even if you don't, you can participate in these PA Salud activities. These are some photos from PA Salud at their various outreach events. I'm so sorry. Okay, so let's talk about CASPA now. This is the application system for our program. Many programs, PA programs, participate in CASPA. It is not free. It costs $184 to participate in CASPA and to apply to one school, and then $61 for each additional school. Fee waivers are available through CASPA. So every once in a while, we have someone email us asking our program about a fee waiver. We don't collect, this is not a fee that we collect for CASPA. This is we don't collect any fees for your application. So if you're looking for a fee waiver, you want to reach out to CASPA. They're the ones who provide that. The benefit of using CASPA is it's centralized, so you only have to upload your materials to one place. And then you select which programs you want CASPA to send your application to. The downside of this is that requirements are very different by program. So you want to make sure that you know the requirements for each program before you just blindly go down the list and check off programs to apply to, because it's really a waste of time and money to apply to a program where you don't meet their minimum requirements. So I recommend setting up a spreadsheet, putting the schools that you're interested in the left-hand column, and then across the top, minimum GPA, minimum science GPA, minimum number of patient care experience hours. Do they require the GRE or other standardized tests? Do they require a certain number of shadowing hours? All of that stuff across the top. And then make sure that you have those minimum requirements for the programs you're interested in applying to. We do get a fair number of applications every cycle that do not meet our minimum requirements. And in those cases, we can't even pass those on for faculty review. If you have questions about your CASPA application or there is an error on your CASPA application, you have to reach out to CASPA about that. That is not something that we can fix or address on our end of things. Our current cycle is about to close. So our current application cycle closes on October 1st. That was a change. This cycle, it used to close on November 1st. We moved it up 1 month. And I can tell you that I'm 99% sure that for the next cycle, we're going to move the deadline up to September 1st. That will be announced on our website once that decision is completely finalized. But we are getting so many applications now that, it doesn't really make sense for us to keep our cycle open for as long as it's open. Your application has to be verified by CASPA by or on October 1st. CASPA recommends getting your application in 4 to 6 weeks before the deadline to assure timely verification. That window has pretty much already closed in terms of the October 1st deadline, but I will say, like, sometimes I see applications verified by CASPA within 24 hours. Sometimes it takes a couple of weeks. I think it just depends on, for example, if all your letters of reference are in, if they have your transcripts, they have everything that they need. So just be aware of that. It's like if you submit your application to CASPA on whatever the last day of September, for our program, it might not be verified by October 1st. And if it's not, we can't consider it for this cycle. You can have no more than 2 prerequisite courses planned or in progress at the time of your application, and all prereqs have to be completed at the end of the fall term in the year that you are applying. So it's okay to apply with 2 outstanding prereqs as long as they are both completed by the end of this fall semester. Or whatever the year that you're applying. We used to require a PDF document to summarize your community service work, but we no longer require that document. There is a question that will ask you to approximate how many hours of community service you have completed, although minimum community service hours is not a requirement for our program. Please note, our website is the only source for updated information. If you have like an old PDF, a handout that you got at a fair or that you got at an event with information about our program, please know that that is very likely to be outdated. So if you do have an old PDF, make sure you're cross-referencing it with what's on our website, because our website is the only source for accurate and updated information. So we require, minimum requirement is an overall science GPA of at least 3.0. We do not require the GRE or any other standardized tests. People will ask if they do have a GRE, if we will look at it, and the answer is no. Since we don't require it for our program, we don't consider it in assessing your application. You have to have a minimum of 1,000 hours of patient care experience completed in the US or Canada at the time you submit your application. So some people get hung up on this as well. They might submit their application with 800 or 900 hours completed. And they say, well, I'm going to get the other 100 or 200 hours before I would matriculate to the program. That's not how it works for us. You have to have the 1,000 hours completed when you click submit to apply to our program. We require 3 letters of recommendation. One has to be from a healthcare professional who has known you for at least 6 months. This can be any healthcare professional. It doesn't have to be a PA. It doesn't have to be an MD. It could be the paramedic who you worked very closely with, or a physical therapist who you worked very closely with. We want to hear from somebody who's worked very closely with you in the clinical setting to speak to your potential as a future clinician. The prerequisites have to be completed at a regionally accredited institution in the US or Canada. We accept courses completed online or in person. We already talked about no more than 2 prereqs can be planned or in progress at the time of application, and all have to be completed by the end of the year, fall semester that you apply. We will accept advanced placement for courses from high school, but we have to be able to see which courses you got that AP credit for on your transcript. So sometimes we see transcripts and it'll just say advanced placement, like 12 credits, but it doesn't say what courses those credits are allocated to. We have to see that you got credits for stats, for example, or credits for biology. Also, if it's a prerequisite course that requires a lab, so biology is a great example. Even though you got AP credit for it, we will accept the AP credit for the lecture, but we still require that you complete the lab. So if you got AP credit for biology, that's great, but make sure you complete a biology lab in undergrad to meet our requirements. And we do not have a supplemental application or supplemental application fee at this time. So these are the prerequisites that you need to apply to our program, and these are non-negotiable. So we get a lot of emails, asking if things could be substituted, and really the short answer to that is no. These are the courses that we have identified that you should take in order to be successful in our program. So that's why we don't take substitutions. So we require biology with lab. 1 course. It could be cellular biology, molecular biology, general biology, but we don't accept genetics, immunology, or botany to fulfill this requirement. Microbiology with lab for 1 course. The human anatomy and physiology requirement can be met one of 2 ways. So we will accept either human anatomy with a lab and human physiology taken as 2 separate courses. If you do it that way, the physiology does not need a lab. So just human anatomy with lab, 1 course, human physiology, 1 course. The other way you can meet this requirement is if you take a combined anatomy and physiology together. If you go that route, you need to take ANP1 and ANP2, and both of those courses need to have labs. What we do not accept is a mix and match of those things. So for example, if a student takes human anatomy with lab and they say, okay, that's meeting the anatomy requirement, and then takes ANP1 and they say, well, I'm going to use that to meet my physiology requirement, we don't accept that combination. So it's an either or. So you either take it as 2 separate classes or 2 combined classes. Organic chemistry with lab for 1 course. Biochemistry for 1 course. We don't take a combination of organic and biochemistry as, combined as 1 course. They have to be 2 separate courses. Psychology, any kind of psychology is fine for one course. Statistics, also any kind of statistics for one course. And then medical terminology for one course. If you did not take a medical terminology course, we will accept an online certificate course. If you took a certificate course online, just please email our program for pre-approval for that. There is no expiration on prerequisite courses. We get this question all the time. It's on our website. I guess people can't find it, so maybe we need to move it somewhere a little bit more visible, but there's no expiration on our prerequisite courses. I also want to say that we use the word course very intentionally instead of specifying a number of credits. What we found is that while most undergraduate programs or schools are on the semester system, there are still some that are on the quarter system. And when we put a specific number of credits that we required for each course, that did not work out for the students who are on the quarter system. So that's why we changed it to one course instead of a specific number of credits. So as long as you've taken one course of these courses, whether you're on the semester system or the quarter system, that is acceptable for us. Again, patient care experience, a minimum of 1,000 hours has to be completed at the time you submit your application. Some common things that we see are certified nursing assistant, medical assistant, EMT or paramedic, patient care technician, phlebotomist, pharmacy technician we will accept, and medical scribe we will accept as long as the medical scribe is physically in the room with the patient. We don't accept remote scribing. Physical therapy aide, athletic trainer, EKG technician. These are some of the common ones. This is not an exhaustive list, but these are the ones that we generally see. If you are involved in research, as long as the research involves human subjects and you are doing something hands-on with those subjects, that could be, drawing labs or taking EKGs or hooking them up to EEGs or taking swabs from them, collecting specimens from them, that would be considered direct patient care, even if it's in the research arena. We just can't accept hours for research if, for example, you were just consenting patients for a study or doing bench work. The common mistakes we see on applications, people do not meet our prerequisite application minimum. So we see people who are applying with less than 1,000 hours of patient care experience. We see people who are applying with GPAs that are less than 3. This is less frequent, but every once in a while someone applies with too many prerequisite courses outstanding. They might apply with 2 prereqs outstanding, but one of the prereqs isn't going to be completed until the following spring, so we can't consider that application. Incorrect prerequisites we see sometimes, not as often. Letters of recommendation, I can't stress enough, be really thoughtful about who you ask for your letters of recommendation. You want to make sure that you're asking people who can speak about you, who know you well enough to speak about you. I would suggest not only asking them if they would be a reference for you, provide them with a CV or resume, provide them with some information about why you're applying to PA school, maybe sit down and have a discussion with them about that. I recently read an application where the applicants, one of the recommenders, gave the applicant like very all average on everything. And then in the letter they wrote, I was asked to write a letter of recommendation for this student. I don't really know this student well enough to speak to these characteristics. Which, on one hand, I don't know why that person would have agreed to be a reference for someone they didn't know that well, but just that did not look favorably for that applicant. So just be really thoughtful about who you ask. People will say like, oh, does it look better if I have a letter of reference from a physician or a PA? I mean, the truth is it looks better that we know that the person knows you well enough to speak about your skills, your strengths, give specific examples of when you've excelled. So that's what we're looking for. Your personal statement, again, this is another thing that I can't stress strongly enough. We see so many personal statements that are disorganized, I don't know, just a bunch of different thoughts on paper. They're not unique. We see errors in personal statements. This is I would write it as a professional essay. So using like ampersands or using certainly emojis, don't do that. But also just be really thoughtful. Again, this is your one opportunity to tell us something outside of what the rest of your application or your resume tells us. We want you to be genuine. We want you to, share with us something about yourself that we wouldn't know otherwise. I would strongly encourage that you have many people proofread it, provide feedback. I strongly discourage you from using a large language model like ChatGPT to write it for you. We do have ways to figure that out, but we want to hear from you. And this is an incredibly important component of the application for our program. So this is definitely something that you want to spend time doing. I don't think the personal statement is something that you sit down and write in an hour on a Saturday. It really takes several drafts to get it just right. And then make sure that you meet our application deadline. Tuition and fees for the class of 2027. This is our class that just matriculated. It's $110,000 basically. And this is just tuition and fees. This does not include living expenses. Student loans and outside scholarships are available to PA students. We do have a dedicated financial aid office in the School of Medicine. So if you have any financial concerns, they would be the ones to reach out to. And of course, tuition is always subject to change. For our class of 2027, we have 40 students. It's really nice. We have a small cohort, which is really great for faculty and I think and for the students. They came in with an undergrad average GPA of about a 3.7 and an undergrad average science GPA of about a 3.6. Just to give you some context in terms of the student profiles of students who get accepted. They also have about 3,700 hours of patient care experience on average, and the average age is 24 years. They are from 20 different states and one Canadian province and from 33 different undergraduate institutions. This is them. They're I think, first or second week of classes, and they got through their summer semester and are already well into the fall semester. Last cycle, we received just over 1,200 applications. I can tell you this cycle, at this point, we've already received over 1,500 applications. Last year, we had about 16% that didn't meet our minimum requirements. So again, be very careful about that. We interview 180 candidates to fill a class of 40. So by the numbers, that's an overall acceptance rate of about 3.3%. You have a 15% chance of getting an interview. And if you're interviewed, an offer of acceptance is about 22%. So it's extremely competitive. I just want to be transparent about that. This is not meant to deter you or to sort of scare you off, but just to be super transparent that when you have 1,500 applications and 40 seats to fill, it's a very competitive process. So from April to September, you want to prepare your best application. Again, apps need to be verified by October 1st. We've already had 2 interview days for our current cycle. We have 3 more to go. We're going to actually finish interviews in November of this year. The weather is too precarious in December for my comfort level, so we're going to end in November. So we have people, our interviews are in person, so we have people traveling from all over the country for interviews. We let people know whether they were accepted or not on a rolling basis, and our classes start in mid-May. Here is the link to our website. We also have an Instagram. We have one that the program sort of maintains and one that the students maintain. So please check that out. We also have a page or an account on LinkedIn if you want to follow along with us on social media. Please email us with any questions. We do not handle any admissions related questions over the phone. We need to have a sort of paper trail, if you will, of the conversations that we have so that if anything comes up about your application down the line, we can go back into our emails to see, what that conversation entailed. We will get back to you within 1 to 2 business days. We are very good at, very responsive. We only have one more webinar this year. It's on November 11th. Again, it'll be from 12 to 1. As long as you register for the webinar, you will be sent a recording to the webinar the next day. So even if you're not able to attend it live, you will still get a recording of the webinar. All right, so that was a lot of information from me. We have, do we have Sydney and Aislinn on? Yeah, it looks like. Yes, awesome.
Hi.
So Sydney and Aislinn are our current students. They're in the class of 2027. I'm going to ask them to each introduce themselves, let you know where they went to undergrad or maybe where their hometown is, and then also what made them choose Case Western as their PA program. And then after they introduce themselves, we'll move on to questions.
All right, so hi, I'm Sydney. I graduated from Ohio State University in spring of 2024. The big reason that I first applied to Case was I'm from Ohio, so I knew that they had a really reputable program and strong clinical affiliates. I also did a lot of community service when I was in undergrad, and that was something Case emphasized a lot. And so I wanted to be in a program that also valued that. The really big thing that made me stay was my interview. I cannot stress enough how amazing our faculty are here. They care about you so much beyond your role as a student. They care about you as a whole entire person. So that was the big stuff that sold me on coming here.
And then my name's Aislinn. I also went to Case Western for undergrad. So that's kind of where I first found out about the PE program here. I'm originally from Colorado, but I think similar to Sydney, I knew that it was a reputable school. I knew that we had good connections with hospitals, and just kind of had a good reputation in general. But genuinely, also what sold me was the interview, meeting the faculty, all the other students. I think just they put together such a good group of us, and you just can tell that they care so much. And so it's such a welcoming atmosphere, and it's a great program. Yeah.
Awesome. Thank you both, and thank you both for spending your lunch hour here with us.
Yeah.
I will say that it is very competitive to get into our program, but once the students are in the program, it's a very collaborative environment and very supportive environment. So that is sort of our culture here. And, again, the culture of PA programs differs by PA program. So the programs you apply to, if you get to interview there, that's a really good way to sort of get a sense of what that program is about as a culture and as a community. So awesome. So now we will open it up to question and answer. I don't know if Logan or Adina, one of you can maybe help sort of with those questions. And for those of you who are on as participants, feel free to ask questions to either Adina, Logan, or myself, or if you have student questions directly for our students about being a student in our program or anything like that, you are welcome to ask questions to the students directly.
I have the chat box open, so if anyone has questions for us, the program, or for Sydney and Aislinn, I can help facilitate that. Okay, so these two are for the program, it looks like. Well, maybe for Sydney and Aislinn. Or no, I guess it would be for the program, but what is what does it look like completing the didactic phase of the program? What is your GPA, and what happens if that is not met in the didactic year?
Yeah, so there is a minimum GPA requirement. At the end of didactic year, the student has to have a 3.0 in order to move on to the clinical year. If the student does not reach that minimum GPA, they will not be able to continue on in our program. I will say that, we as a faculty work very hard to identify any student who is struggling or at risk of potentially not meeting that GPA and intervening. So it will not be like a surprise on that day. If a student all of a sudden is like, oh, I can't go on to clinical year, that will be something that we have been working on with the student to try to get their GPA up so that they're able to progress onto the clinical year.
Great, thank you, Kate, for answering that question. We have a question here for Sydney and Aislinn. It's asking, what aspects of the didactic year helped you feel most confident and prepared when transitioning into clinical? So they're still fairly new and just getting started with didactic, but I'm sure they can answer at least the beginning part of this.
Okay.
Yeah, I will say we're like just now selecting our clinical rotations. And so we're still kind of far out from that. But I think in general, so far, what's like felt really important to me is that the program's extremely organized. And when you're like taking in so much information, you don't really even know where to start. Like you need a program that's going to be able to direct you in the right place and be able to help you when you don't really know what the next course of action to take is. And so that's where I think I felt most supported is I just know that everything is a certain way for a reason.
Yeah, I will say too, our curriculum is systems based. So right now we're doing neurology, endocrinology, and dermatology. And so within each body system, you're learning all of the pharmacology, all of the internal medicine, any of the physiology that goes along with each individual system. And that has been very beneficial for learning each individual system. So I feel like when it comes to transitioning to clinical year, hopefully everything will be compartmentalized in my brain in that way. But I've really enjoyed that aspect of didactics so far.
Great, thank you for that. I have another question for you two. We have someone asking, what kind of academic and wellness support is available for the students? An example, like, tutoring, advising, counseling, or if you want to speak about like our wellness committee too.
So we each, when you start the program, you'll get a mentor from the class above you, and they'll reach out to you before you even start. And I feel like that's been a helpful resource for me. The class above shared all of their like study resources with us. They shared like study guides that they had made before, which were really helpful to kind of go back and make sure that you were like double checking all your information. You also have an advisor that's a faculty member that you meet with like minimum once a semester, I think.
Yeah.
Usually more. And then you can talk about the other.
Oh, yeah, we have the wellness committee. So that's something that I guess we're in the process of applying for right now. If you wanted to be a class representative, there's a little committee of people, and then you can, if you're a part of that, get to kind of like organize, I guess, more like social events or wellness events to do outside of learning. So it's just like another way to interact with each other that's not just in the classroom during lecture, which has been nice to get to know people outside of that way.
Yeah, and if I can just piggyback on that. So in addition to what Aislinn and Sydney just said, there's also a remediation process. So I'm the remediation coordinator. So for students who are having a hard time with exams, there is a process for that. Again, we want all of our students to make it to graduation. So we do everything we can to support students who might be struggling. There's also a counseling center available for students free of charge at Case if they need any mental health support. And there's also accommodations available. So if a student requires test taking accommodations, so for example, extra time on exams or dedicated quiet space for taking exams, or even a couple of our students are parents. So maybe accommodations for their parenting responsibilities. There is a whole office that deals with that. So we have this great thing about being in a school of medicine is that there are so many resources available to our students. And so we have many different touch points for supporting our students and for student wellness.
Great, thank you. So another question for Sydney and Aislinn, what does a typical week look like for you two? And how do you balance your classes and studying and personal time?
So this is, I feel like a question we get all the time. Summer term looks a little bit different just because you're primarily doing anatomy. You have some other classes as well, but your main focus is like an in-depth systems anatomy class. It's like basically what you're doing. So that I feel like we had a little bit more wiggle room in our schedule just because a lot of the times we would get out early and you'd have extra time to study. Now, as we enter fall, as Sydney mentioned, it's like we're entering our new systems. So it's all like internal med. So I think in general, our days have been a little bit longer, but I still feel like I have a lot more personal time than I thought I was going to.
Yeah.
And, we've been able to go out to concerts, we go out and like try different
Yeah,
restaurants on the
coffee
weekends.
shops.
Yeah. And so you end up having a lot more time than you think you would.
Yeah, especially because right now, all of you are probably like you're taking however many credit hours of courses, you're working, you're volunteering, you might hold a leadership position. So I think that was like the most unique part of the transition is for the first time, my only job is studying. And it's a lot of studying, but at least it's just one thing to focus on. But it's what you make it. It's the biggest thing that's going to get you through is being disciplined. You're going to have time to do fun things and exercise and maintain hobbies if that's something that's important to you. Um, you just have to kind of, at least for me, don't force yourself to work when your brain is not working with you. Work when your brain wants to work and give yourself rest when your body is telling you that you need to rest.
That's such great advice. I just want to also add too that our program for fall and spring semesters, again, summer is a little bit different as Aislinn and Sydney mentioned, but we operate on a block exam schedule. So students take about 3 weeks of courses and then they take a week of exams. During that week of exams, they are not taking courses, they're not learning new content. So they are truly, that week of exams is just dedicated to exams. That is very different from the experience I had as a PA student where I was taking an exam every week. So every Thursday we had an exam in our PA program and it felt very much like you're just trying to keep your head above water. I would basically study for that exam that Thursday, immediately after taking that exam, try to catch up on everything that I learned that Monday through Wednesday, the new material to prepare for the next exam on Thursday. It was very hard. And I don't think it really promoted retention in the way that the block schedule does. It also gives the students a dedicated break. So after the block exam week, that weekend, truly they can really kind of take a step back and recharge and get ready for the content that will be on the following block of exams. So I think that I've never worked at or been in a program with a block exam schedule. The previous program I worked at also didn't do exams that way. And I think that has been extremely beneficial, both for student performance, but as also for student wellness.
That's so great. Thank you for those answers. I think that really puts it into perspective. And I know, like, for myself, when I'm coming in the morning, I do see a lot of the students together studying or by themselves studying or just kind of taking a couple moments to prepare before the days ahead of them. And it's always refreshing just to see how committed they are. It's great. Um, I don't have any other questions at this time. So if anyone has a question, please send it in. And if not, we may end a few minutes early.
Yeah, and if your question wasn't answered, I saw somebody I think has raised their hand a couple of times. We don't just either put it into the chat or in the Q&A. And if you didn't have an opportunity to do that, you're welcome to email us at paprogram@case.edu. Adina and I handle that email alias. And again, we will get back to you in 1 to 2 days, business days. And don't hesitate to reach out for us. We know that there's a lot of questions about admissions and PA programs. So we want to make sure that your questions are answered. And it looks like one more just popped into the Q&A. So we'll take this one before we wrap up today. Is it too late to apply for this cycle? Earlier the better. So it's technically not too late to apply to this cycle, but I will say that we only have, I can tell you, 2 interview slots left. Out of the 180 that we offer, we have filled 178. That's not to say that people will not cancel their interviews. That happens usually every cycle as we get later into the cycle and people get accepted to, they may get accepted to other programs. They may not keep their interview with us. The earlier, the better is generally the way to go, as long as you have our minimum requirements met. The way it works for our program is that we review applications as they're verified by CASPA. So our cycle opened in April. As an application is verified, Adina and I check to see that it meets the minimum requirements. If it does, it's sent on to faculty review. A faculty member scores that application, and based on the score, that will mean either the applicant is invited to an interview or not. So the earlier you get your application in, it just starts the process earlier. And again, we have 180 interview slots that we start filling basically as of May. So you want to make sure that, yeah, I mean, you can apply now. We don't have many interview slots left, but if you apply and you know, we want to invite you for an interview and we currently don't have an interview slot available, as cancellations come up, we will send out interview invites to fill those canceled appointments. But it's technically not too late to apply this cycle, but I would say in general, getting your application in earlier in the cycle is better. So with that said, I want to say thank you to Adina and Logan for supporting this webinar with me, and also to Aislinn and Sydney. Again, I think it's so important to talk to current students and get their take on both the application process and their experience as students. So the more opportunity you have to ask questions to current students, I think the better. So thank you both again for spending your lunch hour with us. And again, we're going to do another one of these on November 11th. So you're always welcome to register for our events again in the future. So thank you again for everyone who tuned in, and we wish you the best in your application process.